we do want to move to the participant presenters, and we had 5 individuals. Now, many of them also asked questions, which is why you're seeing their name again ahead of the session. Do pay attention to those updates to prepare for the discussion group. And so we have Alain, Blaise, Tatsinkou, Yousef Al-Yaqouby, then Khalid Abubakar, then Calvin Tonga, and then Oyazer Nafsar. So without further ado, you will see a timer on your screen, and you will have 3 minutes to orally present in response to these 3 questions. What is your selected GRISP transformative investment? But really what we're interested in is why that one drew your attention and why you've selected it. How does it apply to your country context? And that is the second question. And then 3, what are the 3 to 5 strategies that you've prioritized? And again, how have you thought through the prioritization that you'll be, the prioritized strategies that you'll be presenting. So with those questions in mind, I'm pleased to introduce our first presenter. So he's been very active in the community. Alain Blaise Tatsinkou is a solution-focused public health consultant, and his country of focus is Haiti. But I'm going to now unmute his microphone, and you'll also, okay, Alain Blaise Tatsinkou, welcome.
Yes, welcome, Rida. Good morning, can you hear me?
Yes, indeed, loud and clear. So without further ado, I am going to start the timer, and you have 3 minutes to tell us about your transformative investment in your country context.
Right. Okay, thank you very much. In fact, I have chosen the community involvement as a selected transformative investment because I know the context. I've been working there for more than 3 years. So, like I was saying, during the last when we were writing the CMYP 2016-2020, we do work on a 9 transformative investment, but we didn't go much deeper in the communication part of that. And then we know that it's something really important for the country at the moment, because we really want the community to have the shared responsibility of immunization delivery. And that is something that goes beyond immunization, but the entire health system. I think that the community is the stakeholder who has not to really actively involve. That's the reason why I think we should multiply our strategy to make sure that, in fact, they are involved, because they are the most beneficiary of what we are doing. So that's why I choose it, knowing the context, and then know the possibility that the API program can gain from that. And we were having like a set of 7 strategies. I have to go quickly. First, the big orientation was to engaging the communities and creating the demand for vaccination. That's the most important. The demand has to come from them. As soon as we reach that stage, we will, better our coverage, because as you see in my test, what I was saying is, like, since a couple of years now, the coverage is not involving. All the indicators from VPD surveillance and immunization, the routine one, they are going down. Despite we are working a lot to try to remediate to the situation, but somebody is missing out, and it's the community. So we want to mobilize the community. We want to mobilizing and communicating for vaccination. Really important. We have the tool for that. We have technology. We can use the technology with that opportunity without really big cost to try to, to disseminate messages, to disseminate what we want from the community and get them involved in this immunization activity. I think that we are all gaining from that. And we are getting we have a lot of type of vaccine now, and making sure that the existence, if they occur, are really addressed, which is really important in vaccination. So we want to establish a national IFE review committee to be able to rapid and trustworthy, and that is really important. But when it comes to choose the 3 from the 7 strategies, I focus on ensure good interaction, collaboration between community and immunization services. And then the second one was to develop immunization information for use in school and training college. And the last one, use social media and mobile technology to promote immunization. Those one has of explanation. I think that I will share that on the website because the time is over. I have to make sure that I...
Thank you. Thank you very much, Alain. We do have some questions for you in the chat window. I'll start. I think some of them have been answered in your presentation, but from Tapas Sadasivan there, how significant is vaccine hesitancy in your country? That's one question. And then Mohammed Miraz Salim asks how to ensure good interaction and collaboration with communities. Do you mention any activities for this strategy? And then Jani wants to know how widespread is internet connectivity in Haiti? Pankaja wants to know the percentage of immunization coverage, and Alexandra has a comment, do not forget that you have to develop AEFI surveillance system and encourage reporting so that your AFI committee would fulfill its purpose. Akachi also wants to know how will you ensure good interaction and collaboration between communities in Haiti. So let's stop now, there are more questions flowing in. Are you able to give us a synthetic set of short, concise answers before we go to the next presenter?
Yeah, sure. Thank you, colleague, for the question. And that's really, I will start with the first one. Can you remember the first one? Because I think that is kind of resuming everything. Yes, the vaccine resistance that is really important. As you know, we faced since 2010, after the earthquake, we have here faced the cholera outbreaks. And with the partner involvement, we do have vaccine from the ICG group, the cholera vaccine that we were giving to the population. And you know how difficult it is to get that vaccine. And we face major resistance from the community. They didn't want the vaccine, despite the outbreak was killing people. And that was a major concern. And that's when we realized that it's really important to communicate with people, even though they are suffering from a disease. They will not demand, if you don't reassure them that the vaccine is safe and that they have to take the vaccine. So that is something that's really important. For me, we have to communicate with the community, not only when we have outbreaks or like we are doing SIA, but in a routine base. That is really important, to be communicating with them routine base, find out solution, creating like committee, and then I will develop everything with our activity. We see that we need to first set up a national committee, a local one with all the sector involved, coming from the community, and they will be advocacy inside the community, and then we will help them with the tools that we have. And we bear in mind that we have technology. We are happy to see that technology is booming. We have mobile phone, we have social network, we have, and then we use all that to spread, to disseminate, to educate, to exchange, to talk with them, to give them their voice, to let them raise their voice, to see what are they hesitating, what is happening on them, because as I say, they are the main stakeholder.
Thank you, Alain. All right, we have not gotten to all of your questions, but we will be sharing the questions. We'll be pulling out the questions and sharing them with the community, and Alain will be, we would be very productive follow-up to have your answers to these various participant questions. So let's now go to Yousef Al-Yaqouby. Yousef, are you able to hear me, and can you speak to us?
Yes, I'm hearing you. Are you hearing me?
Yes, loud and clear. All right.
Thank you. Good afternoon.
Good afternoon. Good to hear your voice. So you're the EPI manager at the Ministry of Health in Palestine, and your country of focus is Palestine. Your transformative investment is the information system. So these are your priority strategies on the screen. I'm going to start the timer, and the floor is yours.
Okay. I choose this transformation investment because, as you know, Palestine consists of two separate areas, West Bank and Gaza Strip. There is no geographical connection between these areas because Israeli occupation. So the flow of data has some difficulties, especially the management and data collection. And the main caregiver in Palestine, two main caregivers UNRWA and the Ministry of Health. There is a connection between them, but some difficulties in data collection and flow of information. So this investment can help us to face these errors and to overcome these. The errors can be facing us. Applying these strategies can help controlling data and managing, monitoring the program. Technology, we have some technology, but software, especially for immunization, we have not till now. And vaccine surveillance or vaccine preventable disease case surveillance, we have a weak point in this section. We are looking for solving and overcome these problems. So I attended to this course.
Okay, thank you, Yousef and yaqouby. All right, and you're finishing ahead of time. So there are some questions here in the community, in the chat for you. Noor Ali Mohammed asks, do you have adequate human resource, particularly district management teams, those that can take timely data analysis and take action on a timely basis? Otherwise, you need to focus on building management teams first. So that would be a suggestion, depending on your answer to that question, for selecting a different transformative investment. Tosin Orhor Hamreru asks, could you share strategies being deployed to increase accuracy and reliability of data? Is there facility-based electronic medical records that help to track this? Adamu Ibrahim asks, considering the security situation of your country, how sure are you that you will achieve the desired objective of tracking each person's vaccination? Acute Shrestha says, good presentation, Alain. So referring back to our first presenter, we're sharing a concern about the sustainability issue with using social media and mobile technology. Emmanuel asks, is Yousef seeking to develop an electronic child health register or e-health for all tools? Helen wants to know if you're going to computerize the data. Tsegai Gute says, what does EPI data quality look like in Palestine? Aden, how can you address data accuracy and reliability if data collection is a challenge? A comment from Alexandra Karik from WHO. Advantages of immunization registries are many, however, a lot of groundwork to be done. Make sure to define scope and objectives before its development, and maybe consider the starting point also designated to expand. And just so you understand, I'm reading these chat messages because people viewing the recording will not be able to see the chat necessarily. Bashir Ahmed, planning is the mother transformative. Try to plan thoroughly. Mimi asks a question that's been asked by other participants. Do you use electronic health records? Are you planning for ODK to end user? Paul asks, what challenges do you envisage in Palestine to assist you in investing in an information system? Bebe wants to know if there's a strong manual system at health facilities in Palestine before automation. And Mohammed Kulufara asks how health system is working in your country, because as my knowledge always is fighting, and what is the default rate? Okay, Yousef, that's a lot of questions. It would not be reasonable to expect you to answer all of them, but would you like to, what seems important to you to clarify for your colleagues so they understand the situation that you are facing and they understand your choice of transformative investment?
Yes.
Go ahead, Yousef. Yes.
I didn't hear the last thing.
So that they understand the challenges that you're facing, what is important that you would like to share, so that they understand why you have selected this transformative investment. And if there is any short points or responses to address the questions from your colleagues. And
yes, I will answer all the questions from my colleagues about the situation, and we are living in Gaza Strip and in Palestine as all.
Okay, thank you, Yousef Al-Yaqouby. So again, we'll be sharing these follow-up questions. We'll find the useful way to put them into the update for the discussion group so that the conversation may continue. We have many more presenters, and again, we will be, as some of you have shared, making our best effort to get through the the logistical issues for the course so that we can get to these presentations and hopefully have more time for discussion after each presentation. But again, very impressive the number of questions as well as their quality. So we're now going to go to Khalid Abu Bakr. So let me find you in the chat, and unless I'm missing something, I don't see Khalid Abu Bakr in the chat. And yes, Mohammed Mira Salim, that's what we'll collect the questions and ask the presenters to follow up on them. All right. Okay, so let's go then to Calvin Tonga. And Calvin, welcome. You are an EPI M&E officer in Cameroon, and you're hoping to have a good time. So before we start with your presentation, are you having a good time today?
Yeah, very much. I really enjoyed the meeting of today.
Great. All right. And is there anything we can hear voices in the background that are quite loud, and that would probably make it difficult to hear you when you are speaking? Is there any way at all for you to move or to reduce the noise level before I start your timer? Okay, great. All right, so let me start the timer, and the floor is yours for your country of focus, which is Cameroon.
Is it better now?
Yes, yes.
Hello, is it better now? Are you getting me better now? Okay.
Yes, I'm starting the timer now.
Okay, thank you very much. The transformative investment that we selected is invest in tailored strategy that identify undervaccinated and unvaccinated persons and regularly provide them with vaccines they need. In fact, since 2013, when Cameroon performed its best immunization coverage, that is 88.6%, we've been struggling to get to that performance again. And from experience of routine immunization surveys and also National Immunization Day post-event coverage surveys, we came and found out that many communities that are being missed during vaccination activities are almost the same for various reasons. And the situation in the country, you have some communities that are hard to reach because of security problems. Some also who are living in remote areas, geographical accessibility is not always granted for her workers to get them covered. So we thought this transformative investment, if well developed, will improve on our immunization coverage and ensure equity for all.
I'm no longer able to hear Calvin. Can other participants confirm in the chat if you're also having trouble hearing him? Okay, Calvin. Yeah. We can no longer hear you. Yeah. All right. Well, this happens, and this is part of the this is part and parcel of connecting with people from all over the world. Calvin, we lost your audio for about 30-45 seconds, so I'm going to give you some extra time on the timer. Could you, yeah,
thank you very much. Are you getting me better now?
Yes, now we're able to hear you, but you were cut off for about 30 seconds.
Okay, let me start at some point so that those who did not get me can listen. So what I was saying is that we choose a transformative investment that we choose is invest in tailored strategies and that identify undervaccinated and unvaccinated persons and regularly provide them with the vaccines they need. So the country, when we did the analysis, we saw that since 2003, we've not been able to get to the immunization coverage. We got that is 88.6%. And for many various reasons, One being that some communities are hard to reach because of security problem, because of infrastructure, difficult geographical access, or because of behavioral behavior, especially those who are nomads in the northern part of the Cameroon, and some population also are living in islands and isolated area. So we thought taking them into account is very important for us to improve on our immunization coverage, strengthening the ongoing immunization activities in health facilities. So the priority strategies that we identify was to identify and examine reasons for unvaccinated and undervaccinated. This should be done at the level of the district to be more specific. And once done, the results from the analysis should be taken into account when updating microplans to ensure that all communities are included and targeted within session plans. And this will help ensure equity in vaccination coverage. And the third issue is to revitalize and provide adequate resources for outreach activities, because the analysis of the activities in the country shows that we have low or insufficient implementation of planned outreach services. So we think if we go through this transformative investment could be beneficial for our country in order to increase our immunization coverage and get the targets that we fix in our multi-year plan. Thank you very much.
Thank you very much, Calvin. All right, we have, I see many questions in the chat. Again, we're going to find a way, and this will actually be what you'll be doing in week 2, is looking at 3 of your colleagues' presentations and commenting on them, giving them constructive suggestions, advice, sharing your experience, exactly as you've been doing so well in this discussion group. So unfortunately, we're not going to be able to get to our last presenter because I'd like to ask Jill Milbal and Alexander Karik from WHO HQ to share their thoughts and considerations with respect to the presentations that they have just listened to before we close the session and move to the technical support in a couple of minutes. Go ahead, Jill Milbal.
Yeah, thank you very much, Reda. I'm very pleased with the direction the discourse taking, and the presentations today show that people have really thought about what might be the most pertinent transformative investment to work at the country level. And I just want to remind again something that Alexandra mentioned earlier, is that it would be great at this point that if you can already look at the data from your countries and the important documents in your countries. So look at the strategic plan, the annual plans, the CMYPs, that gives an idea of what the country has been planning, and see if, where this transformative investments could fit in, or if there is a gap. Maybe that is the justification for doing some additional work, but also do refer to those planning documents that are available in your country, as well as the health systems plan, if you can have access to that. In addition, there are several reviews done in the countries often, which point to different systemic problems, and that would be a good starting point to decide which investment to focus on. Thanks very much, and I look forward to presentations next week.
Great, thank you, Jill Mill. Alexandra, would you like to share?
Yes, indeed. I was very impressed with the presentation of our colleagues, and in particular Calvin, who was mentioning focused approaches and investment in tailored strategies. I think that's a very good start. I do not know whether any equity studies have been done in Cameroon, but that is certainly something to look into in order to understand better the barriers to vaccination that we encounter, either gender-based or geography or wealth. We have to keep in mind that coverage overall can increase, but inequalities between households, between locations, between rich and poor can actually worsen. So in order to avoid that, and especially when we reach certain level of coverage, I think really the way to go is to invest in tailored, in focused strategies to identify clearly those who are un or under vaccinated, and that's the way to reach those critical key susceptibles that are left. I am sorry we haven't heard our colleague from Nigeria, and yes, regarding the immunization registries from our colleague from Palestine, I would just once again like to underline that that's a great idea, because this is the future we live today. We are living in the time of high technology, and immunization registries can really have great advantages, not just to identify who is vaccinated or who is not vaccinated, but you can also monitor your birth cohort. You can monitor your you can have inputs in your surveillance system. You can follow your transient or nomadic populations. You can identify easily your vaccination dropout. So really that there are numerous advantages to it. However, like with any database, your objectives should be established prior to the development of the registry, and of course one should start with the assessment of the situations and then explore different options for the system development, and of course not to forget the maintenance of the systems that we usually forget to put in the budget. However, great start. Thank you very much. These were my very few comments for today. Thanks.
Great, thank you, Alexandra and Gilmil. So this brings to an end the mandatory weekly discussion group for week 1. Thank you all for your excellent participation, and both congratulations to the presenters and to all of the participants who contributed to the discussion. Now you know how it works. We'll have more and more time as the weeks go by for your presentations, for your feedback, for your discussion, as we work through the different stages of the course. And each time we'll be focusing on the task at hand, so that this discussion group will hopefully help you with the work that you have to deliver on in the community and in creating